So if you're new to being a caregiver, it can be incredibly overwhelming. I mean, there are tasks to organize, there are new medical terms to learn, there are schedules to coordinate, and then you have to figure out how to get it all paid for. And if you live far away, then you have an additional layer of complexity that you have to add because you can't be there every day. So you have to find new ways to help a loved one who might be struggling to live on their own independently. And it's also often not always clear about who that person should be getting care from and or how much care they need. So welcome back to all of my subscribers and particularly my YouTube and HYSU members. We've built quite a community over the past 4 years of this podcast. And if you're new to this channel and to the podcast, welcome to This Is Getting Old, Moving Towards an Age-Friendly World. I'm Dr. Melissa Batchelor, and I'm a nurse and a nurse practitioner with over 25 years of experience caring for older adults and their families. And I was thinking about this the other day. I think I have about 1.5 years and I'll be at 30 years. So I've been doing this for quite some time. And most of that care has been primarily in nursing homes, but also in other long-term care settings, including the home. And this topic, I wanted to talk about it because so many families struggle with it. And I typically get a lot of questions from my own friends and family about it. And even in the past couple of years, I've helped my own family navigate the situation with my grandmother. So thank you for joining me today. And now let's dive into this week's episode focused on how to choose the best home care for an older adult. Now, if you are an HYSU MVP, I have developed a checklist and a handout that goes with this episode. It's called the Care Options Checklist. If you haven't done so already, you can become an HYSU MVP or upgrade from being an insider to being an MVP by logging onto your membership portal, or you can join at either of these membership levels at MelissaBPhD.com/join. So if you're new to caregiving, what has been your biggest challenge? What's your biggest challenge right now? Just let me know down in the comments. And if you've been a caregiver for a while, who has been your biggest help in figuring out the best home care option for your loved one? And I ask because it's not only about knowing the different types of in-home care services that are available, it's also about recognizing the signs that a person needs more assistance in order to live at home and to age in place. So today, you're going to be learning about the benefits of professional caregivers, companion services, and home health aides, as well as how to evaluate the needs of your family member. So I'll be providing tips on what to look for, also in a home care agency, questions to ask. And when I say home care agency, I mean all of those categories, whether it's companionship care, having a home health aide, or any other types of professional caregivers. But we're going to look at the tips for what you need to know when you're looking for a home care agency, what questions to ask, and then the essential factors to consider when you're making this important decision. So whether you're seeking respite care, daily assistance, or specialized medical support, this episode will empower you with the knowledge to start making informed choices. So now let's dive into navigating the world of home health services for older adults to ensure that your loved one receives the best possible support in the comfort of their home. Now, it can be quite challenging to find the right option in your home, but if you missed my episode a few weeks ago with Neil Shah, he's the CEO of Care Yaya, and I highly recommend that you check out that video, and I'm going to leave the link below in the show notes. It'll also be in the blog that goes with this episode on my website, MelissaBPhD.com. So to get a baseline understanding about the purpose of long-term care services, there are a lot of different options to help people live independently and safely as long as they can, when they can no longer perform everyday activities on their own. Because most people want the same things as they get older. They want to age in place. They want to stay in their own home and be as independent as possible for as long as possible. So let me know if you personally prefer to live in your own home for as long as possible, or if you're already starting to look at other housing and care options. And if so, what housing options are you looking at? But even if you're looking into other housing options now, you just need to be aware that independent living and assisted living facilities really often don't include many long-term care services internally. So if you need additional medical care, rehabilitation services, those are not going to be included in the price of the housing. So housing is actually a little bit separate issue than care. So it's important that you understand what options you have in case you end up having additional medical needs. Long-term care is provided in a lot of different places by different caregivers depending on the person's needs. And in a lot of cases, long-term care is provided at home. In fact, 95% of people never even need to even be in a nursing home. So a lot of times this care is provided by family caregivers, neighbors, and friends. And that group of people are often referred to as informal caregivers, meaning they're not paid. But the person may require formal caregivers who are paid, and this type of care can be provided in the home through in-home care services, service providers, or community-based services. And often it takes a blend of formal and informal caregivers to help this person live at home. And that's what we ended up doing with my grandmother. So the first question you have to ask yourself is, how do you know if the person can continue to live at home safely? And oftentimes the best way to know if somebody needs more help at home is just to ask them directly. But sometimes a person can't acknowledge their need for help, or they're unwilling to ask for it. So you might have to be a little bit more proactive, and even working with your local healthcare professionals to figure out, is this person safe to live at home? And before like a crisis occurs. The next thing is to know that the type of help the person's going to need, because it's not like this is like, okay, I'm living at home and then next day, like I can't, for the most part, unless there's like a crisis, a hospitalization, or somebody gets sick or they have a stroke or something like that. So a lot of times this is kind of leveling. You add a little bit here, a little bit there, so that person can stay at home for as long as possible. So the first thing that you're going to ask is, how mentally aware is this person? Are they showing signs of memory problems? Are they able to manage their own finances? Typically, you'll see trouble with managing finances or housekeeping way before you're going to see issues related to needing help with bathing and dressing. So those earlier tasks are called instrumental activities of daily living. And when people need help with like bathing and grooming, those are called activities of daily living. So in addition to knowing about how well they're functioning mentally, looking at physical issues that they might need help with. So like household chores. Do they just need help around the house? And do they just need help inside the house, or do they need help outside of the house? Do they need help making meals? Are they able to make some meals on their own, but they need help with like maybe their main meal? And then the next question is, how well can they get around? Are they able to walk, or do they need a cane, a walker, or a wheelchair? Because these things might require home modifications. We'll talk a little bit more about that in just a second. Or are they at the point where they are needing help managing their own medications? And then further down the line, do they need help with bathing or showering and getting dressed, or or even help with toileting? So you can see there's kind of this kind of hierarchy of things that you need to think about. But it's important to pinpoint what the exact problem is, because that can help you decide what type of help they're going to need. I mean, if they're doing pretty good, they just can't keep up with the yard anymore, that's very different than someone not being able to manage medications. So you get my point. But if you are an HYSU MVP, please be sure that you go into your membership portal and access the handout that goes with this video, and it's called the Care Options Checklist. And if you aren't an HYSU MVP member now, you can go to MelissaBPhD.com/join. But the Care Option Checklist is going to give you a range of different activity levels within those categories that I just talked about. And the lesser amount of assistance the person needs, the lower that score is going to be. And the more dependent the person is, they're going to get a higher score. So you kind of go through this checklist, and then you add up all of your points, and it's going to tell you what level of care is going to be suggested for that person. So for example, if they scored a 0 through an 18 in those 9 categories, the person most likely could stay at home independently, maybe with home modifications, in-home or companion care. A score of 19 to 23, they may be able to get by with like in-home or companion care, or they might need to be thinking about moving on to independent or assisted living. A score of 24 to 40 points most likely means they're going to benefit from some higher level of institutional care, like an assisted living facility or a skilled nursing home. but they might also do well with inpatient or outpatient rehabilitation or home health care. It really just depends on what they're needing help with. Like if the person has begun to have trouble walking, but they're still mentally intact, they probably would benefit from going to get a little physical therapy or occupational therapy to help them get stronger. And then they just need to continue to do those exercises in the home. But when you get to a score that's over 41 on this checklist, you're most likely going to be looking at either a skilled nursing home or a memory care unit, just depending again on how well the person's memory is thinking. But the assessment is really intended just to be like an estimated guide only. And I've given you some examples when I was talking about the things to look for when you're trying to decide how much help the person needs. But please consult your local healthcare professionals for a more in-depth assessment to help you determine the best use of available resources and options for not only safe housing, but adequate care for your loved one. So now let's talk about some of the options that you have for care at home. And so the thing here is to understand that there are a lot of different care options that are available to help, and they're all financed a little bit differently. Many of these, though, are going to be out of pocket. And so that's another thing that you have to know is what's this person's financial situation. So if you have a loved one that you're trying to care for at home right now, please leave me a comment about how you would go about finding care for them, or if you have had to find care before, what was the process that you used to find care for them? So I helped my mom do this for my grandmother a couple of years ago. And one of the things that was most challenging in that situation is that my parents live in a rural area and not an urban area. So that's another thing to consider is what are the resources that are available in your area? And at the end of this video, I'm going to give you some different resources to help you find home care services in your local area. So when we're thinking about home care, there are kind of three major buckets that you can think through. Do we need to do home modifications? Will we be able to get by with home and community-based services? Or are we going to need home health? And so again, this goes back to the person's physical, mental, and kind of their medical needs in making these decisions. So if you have a person who is pretty much able to walk and get around and can prepare meals, those types of things, you may just need to start with some home modifications. And this is actually what we did with my grandmother. My parents installed grab bars. They had, when she was ended up progressing to being more wheelchair bound, they installed a ramp. But actually they had like a portable ramp that when my grandmother was at my parents' house, they could put the ramp out. And then when she went back over to my uncle's house, they could pull that ramp up. You may need a more permanent solution, but that is an option. You can get kind of a portable ramp or install one. Maybe you need a hospital bed, or you need to make different bed arrangements, like lowering the bed for the person, thinking about your toilets, but definitely making sure you have grab bars near toilets, staircases, and in your shower and bathtub would be important. But does the toilet need like a raised seat? And an occupational therapist would be a really good person that could probably come by and do an in-home evaluation for you. You just need a referral from your provider. And then the last part is just looking through stairs to make sure that there's enough contrast so that you can see the stairs to avoid trips and slips, and making sure that the handrails are sturdy as well. So I do have an episode, it's called Creating a Dementia-Friendly Home, but with home modifications, it's really about making the home more age and or dementia-friendly, because a lot of the things that you would do to make it more age-friendly are the same things you would do to make it dementia-friendly. But I'll include the link to that. The title is just dementia-friendly, creating a dementia-friendly home. So we will put that in the show notes for you as well. The next level is if the person's going to need more community-based services. So this could be maybe just they need a friendly visitor or a senior companionship service, just like Care Yaya, which I mentioned. You can check out my earlier episode with Neil Shaw to learn more about that program. But basically, it's where this particular business has taken college students and older adults and kind of match them based on their needs. But it's only appropriate for people that need companionship care, so they don't have a lot of medical needs. It's more social needs. Maybe they need somebody to talk to, maybe somebody to take them on a walk. That's the type of thing that Care Yaya could do. And you can look for other senior companionship services in your area as well. Maybe they just need help with transportation. One other episode that I did was on a program called NV Rides. This is based in Northern Virginia and kind of the DC metropolitan area. But unlike taking like an Uber or a Lyft, or having to call like a medical van to take somebody to a doctor's appointment, NV Rides really was kind of neighbors helping neighbors. It's a volunteer type system. And volunteers go into the portal, people who need ride go into the portal, and then they're matched. And instead of just doing like Uber or Lyft would just drop you off at the door, NV Rides actually offered door-through-door service, meaning the person would go with the person to their medical visit, make sure they got checked in, and then wait for them and then give them a ride back home. So there may be transportation services in your area that would help somebody get around town a little easier. If they need help with meals, there are meal services like Meals on Wheels. These are available typically through your area agency on aging, but you can also go to www.mealsonwheelsamerica.org, get more information from there, or you can call 888-988-6325, because that's at least a meal delivery service once a day for people who need nutritional support. The next option is adult daycare services. You can find this through the Elder Care Locator, eldercare.acl.gov, or you can give them a call at 1-800-677-1116. And again, all of these numbers and resources will be down in the show notes, and they'll be in the blog that goes with this episode. The other thing for adult daycare services, you can also go to the National Adult Day Services Association, or NADSA.org, or you can give them a call at 877-745-1440. I've also done another program, another episode about the PACE program, which is the program of all-inclusive care for the elderly. And this is when a family opts into the PACE program because they want to avoid having to place their loved one in a nursing home, but it allows the family to work with the PACE program. PACE, if you aren't able to take them to this adult daycare service, they typically have transportation where they'll come pick them up from the home, take them to the day program. There they can get medical assistance. They're given meals, snacks, and there's the socialization that's built into that. And then at the end of the day, that person comes back home. So those are some different adult daycare services that are available and how to find those. And then lastly in this category is respite care. And respite care is when the person doesn't need 24, or the older adult may need 24/7 care. But this is when you as a caregiver need a break or need some time off. Respite care is what you're looking for. And so you can go look at ARCH, ARCH, the ARCH National Respite Locator Service, and they have a website, or you can give them a call at 703-256-2084. And again, all of these numbers and resources are linked down below in the show notes. And then lastly, for keeping somebody at home when they actually have pretty high medical care needs, you can go to the Home Health Care Services website, and this is through Medicare.gov, and choose the Home Health Services tab. Here you enter your location or wherever your loved one lives. You can either put in their street address, their zip code, their city, or their state. You hit search, and a list of all the home health agencies that serve in your area will pop up, and you get the quality star ratings for each of them, as well as the patient survey star rating, so that you can compare the agency that are available in your area. But for home health, they're going to have to require at least a few hours a week They also can provide some overnight assistance, or maybe they just need a few days of the week, but they might also need 24/7. So typically, if you're needing 24/7, Medicare is more than likely going to have that person move into a skilled facility. But again, that varies by state, location, and based on the person's needs. Some other things to think about: that it's not home-based care. It's just different housing options where different levels of care are also offered. I just did a recent episode on housing options for older adults that you can check out, but in that episode, I talk about the difference between independent living, assisted living, skilled nursing homes, and memory care units. But again, that is if you've kind of exhausted all the stuff with home care and now you're needing more care. So some of the resources that I just talked about to help you locate home care in your area. The first was Elder Care, the Elder Care Locator. So eldercare.acl.gov or call 1-800-677-1116. You can also just go to medicare.gov or medicaid.gov. There you can probably find information specific to the questions that you have, but you can also call the Center for Medicare and Medicaid Services, or CMS, and that phone number, you can go to their website, or you can call 877-267-2323 if there's a particular home and community-based service that you're interested in, or you've been having trouble locating them. And again, another great place to call in your local community is the Senior Center. That's part of the National Area Agency on Aging programs that states implement. So that's always another great resource as well. So thank you for joining me today. If you found this information to be of value, please hit the like button, share it with anyone else that it might be helpful for. If you're on YouTube watching this, you can join my YouTube community as a YouTube Insider member and get early access to all the upcoming podcast episodes. And don't forget that you can go to my website, MelissaBPhD.com/join to become an HYSU Insider for free or upgrade to being an MVP. So HYSU is, I'm up to about 195 episodes now, but it's a hub where I've taken all of the podcast videos and organized them for you. There are a lot of digital resources in there. There'll be courses coming out, and there's also a private interactive community for adult children of aging parents, caregivers of people living with dementia, or anyone else interested in learning about aging well or brain health. But as an HYSU MVP member, you get weekly invitations to join me for the live recordings of these podcasts, typically 3 to 4 weeks ahead of them being released on YouTube or any of the audio-only platforms. So it's also an opportunity where you can ask questions of me or my guests during these live recordings. You're also invited to join me once a month for a live Q&A session. And this is really just an open session where you can submit questions ahead of time and I can answer them personally during our time together. But you can also put them in the chat and I will answer those for you as well. There's also a private HYSU MVP Face group. You get a printable HYSU resource guide that provides a roadmap for all the curated content. And this is updated weekly. So basically it's like a TV guide. And you also get members only pricing on all the HYSU courses. But what's really exciting, and we're working on this now, should be done probably by 2025 or the end of 2024, is that we're trying to make all of the videos in HYSU commercial free. And that way you can watch the video content without any ads or interruptions. And the videos, there'll be an option where you can access the videos with closed captioning translation in 10 different languages. So if you have a suggestion for a language to include, please drop that in the comment below and I will make a note of it. So I hope you at least join as an HYSU Insider today. That's free. That will allow me to keep you up to date on all the exciting news and events and things that we're up to here. And thank you so much for listening to this episode and for your support of the podcast. And until next time, be well.